Hello, and thank you for tuning in to our monthly series, the Katz Conversations, where we take a deeper dive to learn more about our clinical experts who serve in the field of women's health. My name is Sharon Zarabi. I'm one of the program directors at the Katz Institute for Women's Health. And today I have the pleasure of sitting with Dr. Titi Adegboyega, who is a colorectal surgeon at Huntington Hospital. Dr. Titi, thank you for joining us. I'm going to let you just start and open your credentials and talk to us a little bit about what you do in your field.
Great. So, as mentioned, my name is Titi Adegboyega. I am a colorectal surgeon with Northwell Physician Health Partners, and I actually go to multiple hospitals within the health system. I go actually primarily to South Shore University Hospital, but also operate out of Huntington Hospital, Plainview Hospital, and Glen Cove. As a colorectal surgeon, my job involves treating anything related with the lower intestinal tract. So that has everything to do with colon cancer, hemorrhoids, Crohn's disease, ulcerative colitis. I also deal with a lot of pelvic floor issues. So people that experience incontinence and difficulties with evacuation, that falls into my field. In general, I like to say if I were out talking with friends and I met somebody, I really deal with guts and butts.
That's a great way to put it. And I guess, we celebrated Colorectal Cancer Awareness Month in the month of March. And being that you are in the field of surgery, I'm just curious, what drew you to this specific niche?
So one of the things that drew me to colorectal subspecialty, particularly after doing my general surgery training, is a handful of things. One was the mentors that I had during my residency. I had two primary surgeons that I gravitated to, Dr. Shapiro and Dr. Brecky, who were both colorectal surgeons, and started me on this path. One of the things I really like about this field is the variety of what I get to do. I get to see patients in an office setting. I also meet patients in the hospital. I get to do surgery. I get to do procedures. And there is a relationship that I can develop with my patients over time. It's not a one time and done. And a lot of the pathologies within colorectal surgery are pathologies that we can actually treat and cure. Part of diagnosing and screening for colon cancer is knowing that we can intervene, we can do surgery and be done and actually cure people of their disease. And more importantly, as part of screening, we can prevent it from happening. If we do colonoscopies, we find polyps before they become a problem, we can remove it and prevent somebody from becoming a cancer patient. So it really is a field that has a lot to offer and a variety. And I know that I can make a difference in people's lives. And that was part of my reason for choosing this specialty.
Right. So it sounds like you really follow your patients at every stage from their diagnosis to symptomology of what they're experiencing, and then trying
Mhm.
to really find a way for them to treat these conditions. So I'm
Absolutely.
just curious, it sounds like there's so many different phases in their care.
Mhm.
What do you feel can be either the most challenging or the most rewarding part of caring for your patients?
Absolutely. So, in terms of what is rewarding about this field, is really knowing that I can make an impact in somebody's life. And when you treat somebody and you care for somebody, it's not just the person that I'm treating that I'm impacting, but also their family, their loved ones, and everybody that cares for that person. I like the fact that, as far as a rewarding aspect, that I can really walk somebody through what they're experiencing and diagnose them and treat them. One of the other things I like is the trust that I can develop with patients. I think people find certain things to be embarrassing. People don't want to talk about their poop, they don't want to talk about their bowel movements or their hemorrhoids, or even other things that they feel alone in, maybe experiencing incontinence or feel like something's coming out of their rectum, like a prolapse. And being able to build that trust to say, you're not alone in actually having this problem, and it's okay for you to have this conversation. This is a safe space, and we can come up with what we can do to help this problem that you have. I find that relationship building very rewarding, and also the fact that sometimes we're able to actually solve the problem and get to a point of somebody feeling much better or resolving and curing the problem they have. That also segues into some of the challenges. Not everything has a finite or very clean cut a solution. And sometimes that can be very frustrating, more so for the patients that feel like, hey, I have this problem and there isn't a definitive solution. I like to tell my patients sometimes that what they're experiencing is what they're experiencing. And sometimes our job in medicine is to make sure it's not something bad or something worse. And we're not always able to, tie it up in a bow and say, here's the problem. Or even if we're able to clearly define the problem, sometimes we're not able to offer a solution, at least one that is acceptable to the patient.
Mhm.
And so that sometimes is difficult to not only have that discussion, but to maybe experience the disappointment from the patient standpoint to say, this is something we have to manage, but we're not going to, in essence, solve it completely. And as a surgeon, there's almost this sense that I always want to put a finality to it. There's something there, we can cut it out, we can remove it. That's not always the case.
I have to really, I mean, there's something special about the humility that you just present yourself with right now of, not always having, the answer or the solution, but being able to have those difficult conversations with your patients or even just navigating them to the appropriate specialist. And that's one thing that we do at the Katz Institute for Women's Health is navigate patients to the appropriate expert who may be able to help. And I think also it's, as a dietitian, poop is like the main topic of conversation in my office where, what color is it and how big is it? And,
Yeah.
what's the texture like? Unfortunately, it's might be an embarrassing topic to speak of, but as whatever goes into the body, poop tells a very important story about our gut health.
Mhm.
And you seem to create a very safe space for your patients to be able to open up to you.
Yeah,
Uh,
and I want people to know it's really, I think culturally we think it's embarrassing, but it is part of normal function. It would be, everybody poops, and it would, similar to saying you should be embarrassed about talking about your breathing. So everybody
mm,
poops, and we need to kind of create a safe space and a culture that, these are things that they're natural, they're
yeah,
normal. So
yeah.
it's okay to talk about it.
Yeah, I think even now that we have our, all of our technology gadgets
Mhm.
with our little poop emojis, it's also been a little more of a comfortable topic to speak of.
Mhm.
So
Absolutely.
I would agree with you on that one. So, again, you're working with patients who might be experiencing, a polyp, a tumor. I'm sure there's a sense of fear with a lot of patients who come through your doors. How do you help them feel comfortable when they're feeling physically uncomfortable and maybe emotionally uncomfortable?
Well, the emotions and the feelings that patients come with to either an office setting or a hospital setting, the operating room, is completely normal. And I think the first step is validating that whatever they're feeling, whatever anxiety or fear they're feeling, is absolutely normal to experience. Sometimes patients may feel like they're the exception as opposed to the rule, and making sure they understand that this is completely normal, I think is the first step. I like to also say that knowledge provides hope. And so one of the things I like to spend a lot of time doing is educating my patients, educating them on what they actually have. I want them to know the diagnosis, educating them on what to expect, because that sometimes helps alleviate the fear and the concerns they may have as to what is going to happen next. I very often, if I'm doing an abdominal surgery, have a drawing of the intestinal tract, and I try to be clear as to exactly where their problem is, what I plan on cutting out, and how things may be reconstructed if need be. And I think that visual presentation and
Yes.
knowledge of this is what is going on, but this is what is supposed to happen. Yes, these are the risks that are listed with this procedure, but this is also what I expect in my recovery. This is what I expect afterwards. How long will it take for me to feel better? And they walk away with that actual piece of paper. I think it's very helpful, because that knowledge helps them to know, okay, well, this is what I'm going into. And then just validating the emotions, however they come associated with what they're going through. I think it's an important aspect of caring for a patient.
Yeah, I love how you say that, knowledge is power, right? And we are visual creatures. And while a doctor can sit with us and tell us a story of what they're going to be doing, in the operating room, I don't think a patient really understands that because we never studied, anatomy. And the last time we probably heard half these terms were in our, the high school biology class. So I love how you use models and diagrams or visuals for your patients to really understand where is everything located in
Mhm.
relation to each other. You also spoke about education, and that's one thing that we do here at the Katz Institute for Women's Health. It's not only getting to know our CAT certified clinicians, but we also have a bunch of webinars on our website, and each webinar is really an educational module speaking at a patient level of, what are some symptoms that we need to be looking out for, what are some diseases or conditions that affect the unique biology of women. So thank you for sharing that, because when you equip them with the proper tools, they're better able to take care of themselves.
Absolutely. And it's a tool sometimes too for family members or friends who don't know or were not
Mhm.
privy to that appointment to know, okay, well, here's the name of the surgery that I'm having, and here's the what to expect. And sometimes the family members and friends would have questions that maybe the patient themselves weren't able to think about at that moment in time where they were, we were sitting down discussing what to expect.
Yeah, I think having that support system is huge, because again, you're
Absolutely.
probably sharing some diagnosis to a patient, and there's so many emotions running through their minds and their heart, and by having that other person to support and lean on, who can be the other part of their brain to ask those questions that they may not have thought of, is crucial. Yeah, so women always do take care of one another. So this is lovely. I think, there's so much that we can take away from what, you've shared with us throughout this, dialogue. But, as we come to a closing, I'm just wondering, what are one or two takeaways that you want women to know and maybe experiment with or apply when they walk away from this?
Well, I think the first thing I would say is that your health is important. And I think that that sounds like it's obvious, but when I speak of health, I don't just mean a diagnosis or, high blood pressure and this and that, but I really think health as a whole and your well being. And women hold a very important role in the lives of their families and in relationships and in the community. And if you're not healthy, it's really hard to function to the capacity that we are able to function in the spaces that we're in. And so I really think it's important that you really take ownership of your health and ownership of your well-being. And so that means really taking the time to take care of yourself. If you need
Mhm.
a, almost a timeout, if you will, to self-care, I think it's just important that you really take the time to do that, because if you don't do that, all the things, all the other responsibilities that fall on your plate would suffer as a result. And so it's important to be able to take that step to actually care for yourself so that you can function to the capacity that you're able to. And I also want to say, there's nothing wrong with being an advocate for your health.
Mm.
Meaning, if you feel like there's something that's not right or you're not sure, I think it's okay to go and ask. It's okay to talk about these things that we're not sure. Is it okay for me to be having this discharge or this problem? Is this normal with menopause? Is it not? I think all these questions that sometimes come up and people are sometimes scared to explore and
Yeah.
ask, be your advocate, find out. And we may not get the answer that we want. It may alleviate some fears or it may make us more anxious, but we're in the driver's seat of our health. And so take charge and run with it. And the more you care for yourself, the better off everybody else that's related to you and everybody else that relies on you.
Yeah, I think that is such an important nugget of knowledge that every female should take out of this conversation, is really to advocate for yourself, because
Mhm.
so much of the evolution of where cats comes from is women feeling like they were gaslit, coming into a doctor's office and the doctor saying, "Well, it's all in your head, and it's just the stress," or it's more than that. What we're feeling is real, and maybe it is stress, but as you said, take care of yourself. I'm just curious, I'm going to put you on the spot today as a busy, surgeon. How do you take a pause and take time for yourself or practice self-care?
Yeah, so it changes with the seasons. I do really much enjoy gardening, and that's one thing that I like to spend time doing in the spring to summertime. I like being outside, so it's a great way to spend time outside,
Mhm.
but also really see the fruit of my labor, which is great. When I plant something and I get to eat vegetables and things like that from what I grow. So I spend time doing that, and I really enjoy it. Part of being outside too, I do enjoy hiking, although I don't get to do that as often as possible. And I try to cut out time to go exercise. And I know that sounds like, for some people it's a chore, but when I do it, it's the time that if I'm on the treadmill or at boxing, I am
Mhm.
boxing and things can wait. So.
Okay. All right. Good answer. And with that, I'm going to put you on the spot. We always like to conclude with some rapid fire questions. So get to know you a little bit more personally, outside of the operating room or the physician office. So, you spoke a little bit about hiking or being out in nature. So I'm going to throw some questions at you and just give me the answer that, first comes to mind. What
Absolutely.
is your favorite hiking trail or anywhere that you can recommend for any of our viewers to
Uh,
explore?
the closest by Cold Spring Harbor, that's a good hike. It's got some elevation to it, and it's got a lot of length if you're up for it. So you can go all the way to the South Shore.
Yeah, I agree. Beautiful, beautiful scene too. Sometimes you can get views of the water. Good answer. I like that. You mentioned boxing and maybe running on the treadmill. So, favorite music to get jamming at?
Oh, so at boxing, it's whatever they play, but some either classic or hard rock. Uh,
Okay. Favorite artist?
that's hard because I have so many genres, but if I'm exercising vigorously, it will be probably in the Lincoln Park frame.
Okay.
If it's in the OR and I need something a little more mellow, it's Dave Matthews, or Coldplay, and just chilling, maybe a little Bob Marley. So very different.
Okay. Good. And then most favorite flavor. I think everyone has a sweet tooth or maybe a flavor for ice cream. So favorite flavor ice cream.
Vanilla all the way.
Okay. Any toppings that you'll put on that?
Maybe caramel, but it's fine just the way it is.
Okay. So this was wonderful, Dr. Adegboyega. We really enjoyed getting to know you on a deeper level and learn more about what you do and who you are. And if you have any other closing statements.
Check your colon and to tell your loved ones to get checked. The best way to prevent colon cancer is to get screened for colon cancer.
All right. Well, thank you to all our viewers for joining us, and we look forward to seeing you next month.
All right. Thank you very much.